Dr. Callahan, you've been the chief emergency medical doctor at Nita Community Hospital for about 2 years now?
2 years, yep.
And a position like that requires a certain high level of thoroughness.
Of course.
And attention to detail.
Of course.
Moving to the night or the early morning when you saw the defendant in this case, Mr. Chambers, you were working on that morning, weren't you?
I was.
October 24th.
Yes.
You saw Mr. Chambers come into the ER.
I did.
You saw Officer Goodfellow come into the ER.
I did.
In fact, they arrived together.
They did.
That was around 1:20 in the morning.
Somewhere around there.
Your Honor, permission to approach the witness?
You may.
I'm showing you what's previously been entered into evidence as plaintiff's exhibits, and if you'll see at the top, you can see that the time of the admission date, or the admission time is clearly marked. Do you see that?
Yes, I do.
And what time do you see there?
1:20 a.m.
Is it 1:20 a.m. on
10.
Officer Goodrich's?
Chambers, 1:20 a.m.
And 1:20 also on Officer Goodrich's?
That's correct.
Goodfellows?
Yep.
Thank you. So, according to the report, it was 1:20 a.m.
Yes.
And when you saw Officer Goodfellow and Mr. Chambers arrive, in fact, Mr. Chambers was in the custody of Officer Goodfellow.
He was.
And Mr. Chambers had blood on his face,
He did.
and he had his hair in his face.
Yes.
In fact, he was bleeding from a cut on his head.
Yes.
A laceration, as you described it in your report.
Yes.
And you sought to administer medical care to
Yes.
Mr. Chambers. That's your job as an emergency care physician.
It is.
In your previous testimony, you previously testified at a preliminary hearing,
I did.
and everything that you said at that preliminary hearing, that was true.
It was under oath.
The first thing that you mentioned in that testimony about your examination of Mr. Chambers was that you asked him if you could give him an x-ray.
Yes.
You were worried that he might have some kind of head trauma.
Yes.
And so that was why an x-ray was important.
Correct.
But you did not at first seek to clean the blood off of Mr. Chambers.
No.
Or wipe the hair off
No.
of his face, or clean his wound.
Correct.
The first thing that you thought to do was to ask him if you could get an x-ray.
Yes.
And the second thing that you asked him was if you could have him give you blood for a blood test.
Yes.
In fact, within 5 minutes of Mr. Chambers coming into the ER, you asked him if he could give you a blood sample.
Yes.
It's 1:25 a.m.
Yes.
That's the time that's written on your report.
That's correct.
In fact, by that time you had already asked him if he would give you a blood test because the blood test was taken at 1:25 a.m.
Yes.
Again, only 5 minutes after he came into the ER.
Correct.
And it was only 10 minutes after that that he was discharged.
Correct.
He came in at 1:20. He left at 1:35.
He did.
The entire examination took 15 minutes.
Correct.
That includes asking him if he would give you an x-ray,
Yep.
asking him if he would give you a blood sample,
Yes.
taking the blood sample,
Yes.
presumably, because it's not in your report, cleaning off the wound.
Yes.
All of that took 15 minutes.
Yes.
15 minutes for the nurse to get the needle,
Yes.
take the blood test,
Yes.
put the blood into a vial,
Yes.
send it off for testing,
Yes.
all in 15 minutes.
Or in ER.
And actually, you gave medical attention to both Officer Goodfellow and Mr. Chambers during that 15 minutes.
I did.
So, in fact, just on average, it's going to be, what, 7.5 minutes per patient?
Correct.
I'm sorry, were you giving me the, are we up?
The 5 minute, no, you got,
You have 30 seconds.
Oh. Also, during your previous testimony, you talked about what's known as a rising blood alcohol.
I did.
And that's the situation where someone has a glass of beer, but their blood alcohol content doesn't rise for a little while later.
It's possible.
Well, isn't that what you testified to in your previous testimony?
With other things, yes.
Is that the nature of a rising blood alcohol content?
Well, there's two things that could happen.
When someone has a glass of beer, it's not reflected in their blood alcohol content right when they drink it.
It depends on the patient.
Immediately, when someone ingests beer, you're saying that it's possible that that is reflected immediately in their blood alcohol content?
Maybe.
No further questions.
Sorry.
That's okay.
You're not a doctor.